Have you ever woken up with an "I that just does not look right"? That sudden redness or irritated feeling can certainly be alarming. It is very natural to wonder what is truly going on and if it might be serious. The main difference between these two conditions is quite simple. Pink eye is a specific medical diagnosis also known as conjunctivitis, which means inflammation of the thin membrane covering the white part of your eye and the inside of your eyelids. Red eye, on the other hand, is a much broader term that simply describes the symptom of eye redness, and this symptom can be caused by many different underlying issues. Pink eye or conjunctivitis typically results in a distinct pinkish or reddish appearance because tiny blood vessels in the conjunctiva become inflamed and more visible. It is commonly triggered by viruses, bacteria, or allergens. For instance, viral pink often presents with a watery discharge, while bacterial pink usually involves a thicker, yellowish or greenish discharge that can crust around the eyelids. Allergic pink eye, in contrast, frequently causes intense itching, tearing, and sometimes puffy eyelids. Red eye, however, is a general symptom that can stem from various causes. These can range from simple irritation like dust, smoke, or pet dander, to dry eyes, digital eye strain, or even something more serious such as an eye injury, an acute glaucoma attack, or a corneal ulcer. Accurately identifying the specific cause of a red is essential for determining the correct course of action. To help you distinguish between these conditions, pay close attention to any accompanying symptoms. If your eye redness includes noticeable discharge, especially sticky or pus-like material, and you also have cold or flu symptoms, it is more likely to be pink. If your eyes are primarily red but also feel gritty, dry, or intensely itchy without significant discharge, it might indicate simple irritation, allergies, or dry eye syndrome. For very minor irritation, a cool compress and over-the-counter artificial tears can often provide soothing relief. However, if you suspect pink eye or if the redness is accompanied by severe pain, sensitivity to light, sudden changes in your vision, or a persistent sensation that something is in your eye, it is crucial to see an eye care professional without delay. Understanding the complete context of your red eye is fundamentally important. While many instances of eye redness are benign and resolve on their own, a persistent or painful red, particularly one combined with vision changes, should never be dismissed. These symptoms could point to a more serious underlying problem, such as acute angle closure glaucoma, which is a medical emergency requiring immediate attention to prevent permanent vision loss, or a severe infection that needs prompt treatment. An experienced care professional has the specialized tools and knowledge to quickly and accurately diagnose these conditions, ensuring you receive the appropriate care. Knowing the critical distinction between a specific condition like pink and the general symptom of red empowers you to react appropriately and confidently. This essential knowledge helps you effectively address minor irritations at home and, most importantly, guides you on precisely when to seek prompt professional medical attention. This proactive approach ensures the long-term health and safety of your irreplaceable eyesight.